with the slow burn of variants across this country. The number of new cases of COVID-19 is dropping right now, but there is growing evidence highly contagious new variants are picking up steam. There are now more than 570 confirmed cases of variants of concern across all 10 provinces. The true number is likely higher since genomic sequencing is needed to confirm the cases. Most involve the variant first detected in the UK, but the South African and Brazilian variants are also here.
These variants have been smoldering in the background and gaining fuel that now threatens to flare up into a new rapidly spreading blaze.
Public health experts warn not to become complacent and that it is too risky to begin easing public health restrictions now. Yet some provinces are doing just that. Ontario lifted its stay-at-home order for much of the province today and reopened schools in the hardest-hit regions. Alberta and Manitoba have also eased some restrictions, allowing gyms and restaurants to reopen with limited capacity. Saskatchewan today extended its public health measures for at least 4 more weeks. All the virus needs to spread is for people to come into contact with each other. We know the variants of concern are much more contagious, and now there is some evidence from the UK the variant first identified there has an increased risk of hospitalization and death. Heather Yourex-West has our top story tonight.
Students in Toronto trudged through the snow to get to their first in-person classes of 2021. Schools reopened in Toronto, Peel and York this week after an extended closure in order to control the spread of COVID-19. But with variants of concern in the community, some on the front lines fear the reopening is coming too soon.
In Ontario, what we're doing is simultaneous school reopening and economic reopening while these variants grab a foothold in our community. And to me, to do those things at the same time doesn't make any sense.
The variant that first emerged in the UK has been detected in all 10 provinces, with evidence of community spread in 4.
The rapid rise of cases in a previously well-controlled situation in Newfoundland and Labrador is a testament to how quickly things can change when more contagious variants are introduced.
That province has now linked nearly 300 cases with the B.1.1.7 variant. Its ability to spread more easily from person to person remains a concern, but now there is also growing evidence to suggest this variant could be more dangerous as well. A document posted by British government scientists Friday examines a series of recent studies on the variant that first emerged in the UK. Based on these analyses, it reads it is likely that infection with variant of concern B.1.1.7 is associated with an increased risk of hospitalization and death compared to infection with non-VOC viruses.
And that risk would be somewhere around 1.3 for every 3 people that get hospitalized or die with the usual type of COVID-19, then 4 are going to be hospitalized or die with the new variant.
Recent modeling in Ontario and Alberta has shown that without new restrictions, the B.1.1.7 variant could become a dominant strain in just weeks, leaving hospitals to brace for an impact that could be more severe than anything Canada has seen before. Heather Yourex-West, Global News, Calgary.
The variants of concern are more transmissible, less responsive to vaccines, and make reinfection more common. Here is how they evolved. The first genetic sequence of the novel coronavirus came from a sample taken from a worker in the seafood market in Wuhan, China. That seed has grown, branching out into a family tree. The more people a virus infects, the more it replicates. Over time, genetic changes occur, creating new branches known as variants. Most variants are of little concern, but 3, possibly more, have emerged with advantages, allowing them to thrive and outrun others. First detected in the UK, South Africa, and Brazil, what makes them extraordinary are the number of mutations they've acquired at once. These 3 possess the N501Y mutation. It affects the all-important spike protein, the key that opens the way into healthy human cells, making these variants, it's believed, up to 50% more contagious. Canada's top doctor says the Public Health Agency is still examining what impact the variants might have on vaccines. Canada's sluggish vaccine rollout is supposed to pick up this week, though today there was another setback, some bad weather. Here's Michael Couteur.
Next week, we're expecting an even larger shipment from Pfizer again. Prime Minister Justin Trudeau is doubling down on his promise to have 6 million doses of COVID-19 vaccines in Canada by the end of March. That's despite bad weather causing a one-day delay to the Pfizer shipment. Vaccine makers like Moderna promise orders will be filled.
He confirmed that, as promised, we are on track to receive 2 million doses of the Moderna vaccine before the end of March.
That's in addition to the 3 million doses of the Pfizer-BioNTech vaccine expected in the next 7 weeks. Still, just 1.7% of Canadians have gotten a shot, far fewer than many of our allies.
On the weekend, the United Kingdom announced that it had vaccinated 15 million people in 60 days. The United States has vaccinated over 54 million people.
I'd much rather be in Canada, given the number of deaths and cases in the US and the UK over the last year.
Dr. Alan Bernstein is part of Canada's COVID-19 vaccine task force. He says Canada is vaccinating at the same rate as countries like the Netherlands. His big worry? The more infectious and more serious variants.
Well, the combination of those two things means it's bad news. And so the sooner we vaccinate people, the sooner we'll have fewer people walking around with virus.
And that's why the focus will soon be on the provinces and how quickly they can get needles in arms.
Will the Prime Minister start showing leadership?
NDP leader Jagmeet Singh wants to call in the military to help with the rollout, but the country's top doctor says human resources isn't the issue.
We have many pharmacists, family doctors, other health professionals, retired. They're all volunteering.
So we've got the volunteers, we just need more vaccines. Pfizer is saying it's possible its Michigan plant could start supplying Canada later this year, likely speeding up the entire process. But a company spokesperson said for now, Canada will continue to get doses from the facility in Belgium. Michael Couteur, Global News, Ottawa.
Though the majority of Canadians are still waiting to be vaccinated, there are new recommendations about who should be given priority in the second phase. Racialized communities disproportionately affected by COVID-19 are among them. Eric Sorensen explains why and what phase of the rollout you fall into.
As vaccines are ramping up, more Canadians will be lining up. The National Advisory Committee on Immunization is prioritizing who, in turn, should be vaccinated. Stage 1, underway now, includes residents and staff of congregant seniors' care homes, those over aged 80, followed by those over 75 and then over 70, frontline health care and personal support workers in contact with COVID patients, and adults in Indigenous communities most at risk. A large percentage from Stage 1 should receive first shots from the 6 million doses expected to arrive by the end of March. Stage 2 includes Indigenous communities not covered in Stage 1, residents and staff of other congregate living settings, including group homes, all those aged 60 to 69, first responders, police and firefighters, essential workers who can't work virtually or from home, and adults in racialized and marginalized communities disproportionately affected by COVID-19. That's a new priority group.
The approach is based on saving lives first and then protecting people that are working close to folks that are at risk of contracting COVID.
A recent summary found racialized people in Toronto accounted for 79% of COVID-19 cases when they only make up about half the actual population. But one expert says the priority should be on jobs that are high exposure, not on race, which could touch off resentment.
These essential workers, where a lot of them are racialized, the job really puts them at risk. And if you have that as a criteria rather than the race, because you can have white people working in fast food restaurants or in grocery stores as well.
If, as promised, millions more vaccines arrive this spring, those in Stage 2 could start to be vaccinated in the second quarter. Stage 3 includes adults aged 50 to 59 and those 16 to 59 with underlying medical conditions, plus non-frontline healthcare and essential workers. These are guidelines. Specific priority groups will be determined by the provinces. With COVID numbers coming down and vaccines going up, the outlook is improving. But there remains an X factor. The COVID variants make the course of the pandemic still uncertain. Eric Sorensen, Global News, Toronto.